Hello, my name is Victoria Batten, and I will be first presenting the introduction for major to mild neurocognitive disorders. I am doing this presentation along with Michaela Cole and Krista Ferkler. So to start out, neurocognitive disorder is a general term that describes decreased mental function due to a medical disease other than psychiatric illness. There are many different things that can cause this, including traumatic brain injuries, degenerative diseases, dementia, substance use conditions, infections, delirium, and complications from cancer or other medical illnesses. In this presentation, we will focus on three specific types of mild or major neurocognitive disorder diagnoses. So the first one will be major or mild neurocognitive disorders due to Alzheimer's, which I will be presenting. The second one will be delirium, which will be presented by Michaela Cole. And the third one will be major or mild neurocognitive disorders due to traumatic brain injury, which will be presented by Krista Ferkler. So to start out, I just wanted to kind of go over the basic description of what a mild and major neurocognitive disorder are, because some of the criteria for the other ones will kind of allude to this. So to start out, the criteria for a mild neurocognitive disorder is, firstly, it's evidenced by modest cognitive decline from previous level of performance in one or more cognitive domains. And there must be concern for the individual by a knowledgeable informant or a clinician. And then there also must be some sort of documentation, standardized neuropsychological testing, or some other clinical assessment. Criteria B is where the two mild and major are a little bit different. So in mild neurocognitive disorder, the deficits do not interfere with the capacity for independence in everyday activities. So the individual can still do activities of daily living like, managing their medications, paying their bills, feeding themselves, bathing, those kinds of things. And then the last two criteria are the cognitive deficits do not occur exclusively in context of delirium, and the cognitive deficits are not better explained by another mental disorder. Now, when we're talking about major neurocognitive disorders, all of the criteria are essentially the same, except that the cognitive deficits do interfere with independence in everyday activities. So the individual might require assistance with their activities of daily living. They might need help paying bills. They might need somebody to remind them to take their medications. And it could be even more severe than that.